Good morning, everyone. Thank you so much for joining us for our fourth session. This one's going to be on employee health and the bare hand contact potential approval of a procedure. So we're excited to have you all here today and eager to get started. But of course, we want to mention that we want to highlight that we're using the Active Managerial Control Toolkit documents. We've been presenting on the changes to the food code for the past several years. So during these quick snippets, we're really focusing discussion on the use of the accessory documents that we prepared to help both explain the intent of the code section, but also help hopefully with implementation. Again, we call the materials the AMC Toolkit. But please know that the materials are a set of recommendations to assist. They're not required to be used. Some local health jurisdictions might have their own materials that they can also support, or they might make modifications. If a written plan is required, an operator may submit any format that actually works for their establishment and their local health department. But of course, we hope you find these materials useful. You can access the toolkit on our website, doh.wa.gov/food rules. There you'll find 8 toolkit documents. We also have the materials translated into several languages, and we'll post those as soon as we have those translations verified. Today, we're going to be highlighting 3 toolkits related to employee health. We've designed the toolkit documents as fillable forms for ease of use, which blocks changes to the main text of the form. However, if you're savvy with Word, you can actually modify the documents by adjusting the ribbon of your Word software and selecting developer and then restrict editing and then stop enforcing protections. There's no password actually needed. Of course, if you need any assistance with that, we can provide additional resources when we post the videos to the web. Okay, again, I really want to thank you for joining us on our 30-minute snippet on employee health and bare hand contact. Handling of food by an infected person is a contributing factor in up to 2/3 of restaurant-related foodborne outbreaks. And in the outbreaks caused by a food worker, the most frequently reported route of transmission involves poor hand hygiene or bare hand contact with food. On top of that, almost 20% of workers said that they have worked during one or more shifts during the previous year while they were ill with diarrhea or vomiting. So we understand there's a lot of pressure for employees to make sure that they continue to support the business or make sure that they can continue to work. So all of these trends are really helping our topic today, which is encouraged also by the fact that it has been shown that restaurant policies and practices can actually help encourage ill employees to stay home or otherwise reduce the risk of illness spread from workers to others. So let's get started on employee health and bare hand contact. I wanted to start today's discussion with the general concept in the food code that the requirements and responsibilities related to employee health are determined by 4 levels of risk. I think this will help us frame the discussion for the different reporting requirements and the different responses based on the symptoms or if it was a diagnosed illness. So level 1 is the highest risk of transmission to the public. Infected food workers in the first level are likely to be excreting high levels of infectious pathogens. And so pathogens are germs that cause illness, which increase the chance of transmission through food. Diarrhea or vomit are generally reliable indicators of infection with norovirus, Shigatoxin producing E. coli, and Shigella. But diarrhea and vomit are not necessarily reliable indicators for typhoid or hepatitis A virus. Diagnosis with Salmonella typhi or hepatitis A virus is included in level 1 because people diagnosed with these pathogens are likely shedding high levels of the germ without showing any GI symptoms. In fact, individuals with typhoid are more likely to have constipation rather than diarrhea. And dark urine or light colored stool are more common with hepatitis A virus, but this may go unrecognized or unreported. So again, it's really important to understand the variety that we can have with foodborne illnesses so that we know that there are a lot of steps that we do to actually reduce the risk of transmitting to other people, including customers. Also, jaundice is not always a reliable indicator. Some people do not experience jaundice when they have active hepatitis A virus infection. Level 2, people that are diagnosed but whose symptoms have resolved are still likely to be carrying the virus or the pathogen in their intestinal tract. They're less likely to transmit than those that are actively symptomatic, so they're a level 2, but they are still at an elevated risk to public health. And so for this, the food code incorporates a range of exclusions and restrictions, often depending on testing, time, or whether the facility serves a highly susceptible population. Level 3 are individuals that have been diagnosed, but they're asymptomatic, so they never had symptoms. They're typically identified through an illness outbreak investigation or other testing. If they had remained undetected, though, they could extend the duration of a foodborne illness outbreak. So again, we have controls for individuals that might have had illness, but they didn't actually have symptoms. And then our final level 4 is the level where an employee reports a possible exposure to an agent. So they're clinically well, they feel fine, but they were potentially exposed, such as consumption of food associated with a Salmonella outbreak, but the employee feels fine and remains well. They present a level of risk lower than the previous scenarios, but they have an increased risk greater than if they had no exposure at all. So again, these 4 levels are how we evaluate our response to employee health and hygiene inside of a food establishment. So let's delve a little bit more into the requirements of the code. Employee health requirements are primarily covered in Part 2 of WAC. If you compare our Part 2 in our WAC, our state food code, with the Chapter 2 in the FDA food code, you'll see Washington has substantially reorganized the employee health sections. What the FDA covers in 16 pages, we cover in about 2.5. While much of it is due to formatting, we actually have 2 key changes I'd like to highlight. The FDA food code provides guidance for the person in charge to return employees that had diagnosed foodborne illnesses. So for example, they give them guidance if an employee had Salmonella, how they can return them back to business. However, our guide, our WAC actually references the local health authority to make that determination. Additionally, the FDA food code requires the person in charge to report an apparent foodborne illness outbreak to the regulatory authority. But our code is a little bit stricter. It requires any possible foodborne illness incident be reported immediately. So again, I think it's important for people to see that Washington State follows the FDA food code, but sometimes we have made a few modifications. So now let's look at our toolkit document to explain the requirements for employee health. Beginning on page 1, in the intro, we discuss the document is not required, but is encouraged to help be used to help the operator train staff on the requirements, because all of their food employees are required to know and follow employee health parameters. While most food establishments are not actually required to have a written employee health plan, such as what we're showing here, those that want to apply to have bare hand contact with Ready to Eat, which we'll discuss later, are actually required to have a written plan, which this document can help support. The rest of page 1 covers the reporting requirements. Section 2 includes the active symptoms and diagnosed illnesses workers must tell the person in charge about. We'll cover what the person in charge is supposed to do when employees report illness on the next page. I'd like to be clear here, especially because it's potentially a privacy issue, and there's potential confusion due to the emergency rules created around COVID-19 about symptoms reporting. This list is very specific to symptoms of illness or diagnoses of illnesses that can transmit from ill workers through food. We actually have a lot more foodborne illnesses that can also spread from people, but these selected pathogens that we have on the list that are from our code traditionally have a very low infectious dose and might still be transmissible even without causing obvious symptoms of vomiting, diarrhea, or jaundice. For this reason, food establishments are allowed to ask employees about these personal health conditions. It's a really important component because sometimes a lot of cities such as Seattle or the state at large have sick leave policies that say you can just take sick leave on demand. You're allowed to take sick leave. You don't necessarily need to declare why. However, if they're a food worker and they're working in a food establishment, they are required to notify the person in charge if the sickness is due to one of these symptoms or these illnesses. The next section on exposure specifically requires that food workers in facilities that serve a highly susceptible population, such as those receiving care in a nursing home or a hospital, report to the person in charge if they've been potentially exposed to foodborne illness outbreak or person diagnosed with illness. So again, this section is going to be very unique if it's a facility that serves an HSP group. But again, it's important for individuals to recognize that if you've been exposed to an outbreak, you are potentially at increased risk of transmitting to others. This section also notifies the worker that they must report any complaint of potential illness linked to the food to the person in charge. Again, this is going to be something that is specific to Washington. It's been in our code for decades. However, it's a little bit different than what's in the federal model food code. So if you have somebody from another state, they might expect only to have to report outbreaks. But in Washington, it's any complaint of potential foodborne illness has to be reported to the person in charge. Section 3 then covers what the person in charge has to report to the local health department. So there are 3 key ones that the person in charge must also report. When a worker has jaundice, so yellowing of the skin or eyes, a diagnosed illness that we listed above, even if there are no symptoms, and if they have a report of a foodborne illness incident potential. Okay, I see a couple of questions in the chat, but I'll probably group those for when we are have our question session. So thank you for those. Now let's look on page 2. In section 4, we review what the person in charge needs to do with employees reporting symptoms of illness. There are 2 actions, either exclusion, which is where the worker must be removed from working in the facility until they are approved to return, or restriction, where workers are allowed to continue working in a food establishment, but their tasks are restricted so that they are not allowed to handle unpackaged food or clean utensils. We've really tried to detail them here. That way, if a person in charge sees that a worker has diarrhea or vomiting, it says food workers may not return until at least 24 hours after symptoms have gone away. If it says it's a diagnosed foodborne illness, then the food worker may not return until approved by the health department. So we provided a couple of prompts here to help the person in charge understand what their reaction should be. We also then in section 5 clarify the need to train staff. Not only is this a key part of the food safety management system altogether, it's actually a new requirement by the code. The person in charge must be able to show or verify that they have trained staff on employee health. Verification can be a signed training document, posted requirements available for workers to view at all times, knowledge by the workers, or other means. And actually, it might need a variety of avenues to make sure employees fully understand the requirements. Often when we're doing inspections and we ask the workers, can you talk to me about what symptoms, how do you know that you're too sick to work with food? Oftentimes they'll think the COVID symptoms, so things that are like coughing and fever, and they'll forget to mention things like diarrhea, vomit, or jaundice. So it really does take constant refreshing and making sure that staff are aware and have access to resources. It's not something that should just be done once when they're hired. It should actually be done throughout the year and often to make sure they're fully trained. Again, it is a requirement. The person in charge has to be able to verify that they've trained their staff on employee health. And then the rest of the document is designed to allow any additional ads by the establishment. So some facilities might be a little bit stricter than the food code, and they can do that as long as they have the bare minimum that the code requires as well. Also, to encourage the plan to be updated on a regular basis, we really want to make sure that people are keeping refreshed on employee health. It is one of our leading causes of outbreaks. Whenever we identify particularly a pathogen that can spread from people, it's often caused by the ill food worker. Now let's look at another document that might also be helpful. We've prepared a food employee illness log. It includes the key points from the employee health toolkit at the top, along with a log sheet at the bottom where the person in charge can track potential symptoms of foodborne illness and their response. It's not designed to replace the employee health toolkit, but it might be a nice tool for those wishing to use the tracking log. We've also included an area for the person in charge to add their local health jurisdiction contact so that they actually have handy access before they need to report. Really want to encourage the partnership between industry and the local health department or the regulatory authority to make sure they know how to communicate, since it's a requirement that they tell whenever they have a potential diagnosed illness or a potential cluster of illnesses or just a single complaint of a foodborne illness, that needs to be reported to the health department so they can have that connection. Okay, so we covered the employee health toolkit, but I've got one more that we want to present to you today as well, and then we'll cover some of the questions. So now that we've covered the employee health toolkit, let's cover our next document on how to apply for bare hand contact. That might be some establishments might want to use. But before we do that, I want to show you a map. This map highlights the states, all shaded in gray or yellow, that prohibit bare hand contact with ready-to-eat foods. Most have done so as they've adopted the FDA Model Food Code. In 1993, the FDA Food Code prohibited the use of bare hand contacts with foods that were ready to eat. In Washington, our state code at the time minimized bare hand contact, but didn't outright require the use of barriers such as gloves to prevent actual hand contact with ready-to-eat foods. However, in 1999, a national advisory committee determined that bare hand contact with ready-to-eat foods actually contributes to the transmission of foodborne illness, and they agree that the transmission could be interrupted They recommended first that exclusion or restriction of ill food workers also helped, but that the risk of asymptomatic food workers would be an issue, and other suggested methods were introduced. So in 2001, DOH began interpreting minimize to the lowest extent possible, and most jurisdictions began requiring the use of utensils and changed procedures to prevent bare hand contact. About 21 years ago now. Our state officially adopted the FDA Food Code prohibition in 2005. So you'll often hear us talking about the 3 key points for interrupting the transmission of illness from workers. The first is employee health, keeping ill workers from handling food. We've covered that quite a bit on the employee health toolkit. The next one is hygiene, hand washing at points of contamination, making sure that workers are washing hands using proper procedures and at proper times. And then also the third one is the use of a barrier from direct hand contact when those 2 points fail, such as using gloves or tongs. These 3 controls are used together to reduce the risk of employees spreading germs through food. However, when we adopted the food code in 2013, the new code language from the FDA actually included steps for allowing a food establishment that doesn't serve a highly susceptible population to apply to have bare hand contact with ready-to-eat foods, if they were also able to tightly control employee health and hygiene to a significant extent to reduce the need for the third control of using a utensil or the glove. The allowance bare hand contact the allowance for bare hand contact under an approved plan in 2013 continues today. It's listed in section 03300, but we found during our recent rule revision, many were not familiar with the section. In addition, we received several petitions to remove the requirement from our code, but the petitioners concurred with us that providing additional education on the potential allowance rather than removing the requirement altogether would potentially work. So that's what we're trying to do. So you'll see when you look at the map, you'll see 4 states that do not have the total restriction with the allowable bare hand contact plan. And that's because it's similar to what happened in Washington. Industry or others petitioned to actually remove the requirement. So again, we are trying to make sure that we allow both options where we have the restriction so that it does help reduce the risk of all of the illness that we have transmitted from employees. But if a business has the active managerial control level and the desire to have additional control for employee health and hygiene, then they can reduce some of their dependence on the additional barriers of tools and utensils. Okay, so let's look at the toolkit for bare hand contact plan right now. And I just want to highlight this one. Again, it's not going to be something maybe that's widely used, but we want to make sure it is everyone knows that it is an option. So again, a food establishment may apply to their local health department for approval. It's not an actual variance of the code. It is an approved plan, but it does require it to be written and including a written employee health policy. You again can read the full code requirements in section 03300, but we've detailed the key points inside this document. And again, this document is not required, and unless an establishment wants to have bare hand contact and wants to apply to their local health department. You'll see throughout the document that it's designed to make sure the person in charge and the permit holder understands that there's an increase of risk that the operator will actually need to control through elevating routine employee health monitoring, training, reporting, as well as increased hand washing steps. I'd like to highlight some of the unique components. The plan needs to include a floor plan with the hand washing sinks identified. The code requires that food workers with bare hand contact have unblocked access to hand washing at all times. A few details also are expected for the extended health policy requirements. While most are included in the toolkit document we discussed a moment ago, several are actually specific to the establishment and must be addressed separately. The document also includes specific training requirements as well as additional control measures, a required illness log, such as the one we covered a minute ago, and additional hand washing steps. So again, I just want to highlight the key components here. I'm not going to have enough time potentially to go over all of them in depth unless you have additional questions at the end of the session. Now let's look at page 2. Page 2 continues with corrective actions when the bare hand contact plan is not followed and an acknowledgement by the person in charge of the increased role. Again, we want to be really clear that it's not that you apply to have bare hand contact, it's that you're encouraging and making sure that you have all of the other control factors very tightly recognized. So the employee health and also the employee hand washing. You have to make sure that those are increased inside the facility before you're able to reduce the reliance on the use of barriers. So again, we'll talk about corrective actions, the person in charge acknowledgements, and then also some documentation requirements. So in general, most of our code does not require things to actually be documented and written. However, if you're going to allow bare hand contact, then it does have to have some documentation requirements. Then the rest of the document includes training and plan maintenance reminders. So ultimately, a food establishment that does not serve a highly susceptible population and also has a high level of active managerial control can support the extra employee health and hygiene requirements. And then they can then allow for a hand contact and ready to eat foods. But again, it's going to require a written plan, several specific unique controls, regular maintenance, and then approval from the local health jurisdiction. So in conclusion, ill food workers are a leading cause of foodborne illness in food establishments. Excluding ill food workers helps, but we share germs even when we feel fine. Hand washing reduces the risk, but is not 100% effective. And then using a barrier like tongs or gloves adds that third hurdle to help reduce the risk of spreading germs from workers. Again, everyone must be aware of reporting requirements. It's very important that the workers know what to report to the person in charge, and the person in charge knows what to report to the health department. And again, Washington prohibits bare hand contact with ready-to-eat foods, but an approvable plan is an option. So again, employee health and hygiene are key. It is definitely a tough conversation. You need to start early. It's difficult sometimes to talk to people about the symptoms, something along the lines of diarrhea and vomit. You need to have those discussion points. Understand sometimes also some people may define the terms differently. So traditionally we will consider diarrhea something that's a frequent basis, usually 3 times in a day. Vomiting, if it's not caused by something that you can identify as something else, more than twice traditionally would be like this is potential foodborne illness. So you really want to make sure that you have that conversation. And again, everyone must be trained, and training should include refresher updates. All right, so let's try to clear some of the questions. Again, recognizing that we covered some information pretty quickly, wanted to make sure that we did keep your timeline covered here. So let's talk about something. And Jennifer, I'm not sure if you want to go off mute on your question, but the question is, what about something like extreme jaundice from an existing condition? I'm asking because I saw this yesterday, someone working with food with extreme jaundice, and they said they have an existing liver condition that causes jaundice. Okay.
Yeah, I know that's more of an employee health and not necessarily the bare hand contact plan that we're talking about today, but since you brought it up, it's just fresh on my head. I saw this yesterday. And I see that the information that Lindsay posted, which is great. Yeah. Should I tell him that he is restricted until this has come through, or should I just take him on his word that this is an existing liver condition and request that in addition to him working? I mean, how serious is that symptom of jaundice? Is kind of what I'm getting at.
Yeah, so they do have to have, and thank you to Lindsay also for posting the allowance. So a person, and sometimes there are existing situations that are not caused, the liver can have other damage that is not going to be something that's transmissible or indicative of something that's transmissible through food. So hepatitis A virus is the one that we're primarily looking for. And so if they do have a letter from their health care provider and can show that it's not something that's transmissible through food. So this can also be, you might have something like Crohn's disease, which causes diarrhea, but not necessarily from an infectious source. So there are several cancer, for example, also some of the medications that people take can cause some of the symptoms that can mimic a foodborne illness symptom, something with their GI tract. So this actually can happen relatively often. And so the code does have allowance. If it's not something that's infectious, transmissible through food, then the worker can present a letter either to the person in charge or also to the health authority. We've actually had we had industry requests to allow the worker to submit it directly to the health department and not necessarily go through the person in charge. So they do have those options. However, they should have that approval from the medical provider before they're allowed to return back to food service. So I see a question, and we'll cover that too. I didn't highlight that during the toolkit. It's designed to, if they have jaundice, to report to the health department, and then the health department would go through that. However, we'll see if we can find a good way to add that into the FAQs, because again, it is a situation that could happen and people need to be prepared for that one. Perfect. I appreciate you asking that one, Jennifer. Gunnar, are you asking if one of these has ever been approved, a bare hand contact allowance? We have a few counties online that I know have evaluated them. I believe some of them have been approved. I don't know if anybody online wants to mention it, but yes, I have seen that these have been approved. And again, it's designed for an establishment that has very solid active managerial control, and they want to go to that additional level. Again, to reduce the illnesses from ill workers, we generally have 3 steps. One is to exclude the ones that are noticeably ill. That has limitations. Second one is to do hand washing. Unfortunately, that one also has limitations. The third one is for preventing bare hand contact. So again, whatever we've touched, whenever we've gotten germs in our hands, we don't transmit those to food. So if a facility can really emphasize the employee health monitoring and the hand washing capacity, then yes, they can apply. And so I have seen them approved, but it's going to be a facility that has very solid active managerial control. Looks like we have a question about vomiting and diarrhea. Does a food worker need to be 24 hours symptom-free without the use of medicine before returning to work, or can they be 24 hours symptom-free without the use of medicine? That's interesting. So I'm going to have to probably follow up on that a little bit. I appreciate that question. So traditionally, when it's a diagnosed illness, we are looking to clear people without the assistance of medicine. It's not clarified in code that it's without the existence or the addition of medicine. So an example would be if you have diarrhea and you take an antidiarrheal, you will probably stop faster, than if you potentially didn't take the medicine. So get the follow up on that one. In general, we say 24 hours symptom free, but I don't think we've ever discussed if it's with the use of medication. So I appreciate the question there, and I'll make sure we get clarity on that one. What is the rule for wearing fake fingernails? So we have a couple of sections that we don't cover in the employee health component. We are looking at adding additional toolkit documents. This one was very specific for illness, so infectious agents. However, there are some components in the code about hygiene. So making sure that you don't have jewelry on your arms or your wrist or your hands other than a single ring. And along with that is the fake fingernail. So we'll look at how we can add that in. I appreciate the question, Margaret. But the requirement is if you have artificial nails, you're not supposed to have nail polish either. And if you do, then you need to use a glove to cover over those whenever you're actively preparing food. So you're handling unpackaged foods. So what the rule would be is you can have artificial nails and nail polish, but you would actually need to put a glove over that whenever you're stirring soup. Even if you're not like directly making a sandwich, you would have to, you're using a spoon to stir something, you should still use a glove over that to make sure it doesn't chip or fall into the food. It does also make it difficult to clean. We appreciate that. Some businesses don't allow them at all. And so sometimes businesses are stricter than what the food code requires. But if you have artificial nails and nail polish, they need to be covered with a glove whenever you're preparing food. So again, where that's a little bit different is even if you're just stirring something with a spoon, which technically you wouldn't need to wear a glove for, if you have the artificial nail or nail polish, you would have to apply the glove. Looking for advice on a raw oyster shucking bar. They wear gloves, but not the normal type for contacting foods, the heavy duty ones for shucking oysters. So yes, we have, we'll probably put some guidance in on this in our FAQ. I could see how this one could apply to quite a few different places. So you'll see like chainmail kind of gloves or something that's heavy duty. So when somebody's shucking, especially, or cutting meat, until they're using a knife, they can often use gloves that protect for injury. So that's kind of what you're seeing there. So traditionally what they'll do is they will use those to make sure they're clean, food grade, and then they'll put a regular, like a food handling glove under that. So we'll put some clarity there, but in general, those should be washable. They're a food contact surface, and if they're going to touch directly to food, but they would put a regular glove underneath that one as well. So again, we'll find some additional language on that one, Sandy. Is the PSC required to notify the health department if a worker reports having symptoms of vomiting and diarrhea? Yes, no, they're not. So again, if the if the person in charge has questions, they can contact the health department. But if it's a worker reporting vomiting, diarrhea, they don't have to report that. However, where it becomes an issue is if it's like, well, wait a second, we think other workers also have this. There might be something going on in our facility. So a single isolated case of somebody calling out sick, no. However, if it's like, whoa, wait a second, we actually have a couple of our workers that are reporting sick at the same time, that should be reported, because again, that could potentially be an illness outbreak. Years ago, I came across a food worker suffering from vomiting during okay, I'm kind of reading this out loud, but I think it's more of a comment, from morning sickness. So yes, that would be included in the list of items that we would include as something that's not caused by an infection. It's just caused by something that the body's responding to. So that would be something that would be eligible to allow a worker to work, but again, with a doctor's note and approval. Okay, I think, and we did have some discussion here as well about some of the counties that have approved the bare hand contact allowance. So again, we just really want to emphasize that it does take quite a bit of active managerial control. It takes quite a bit of understanding about the potential risk that the business would be taking on. And that's what we try to be clear about in the toolkit document. But again, it is an option, and it does have some potential for some businesses. So we want to make sure everyone's aware of that. Really want to thank everyone for joining us today. Feel free, if you'd like to linger a little bit after the session, if you want to add a couple more questions that you don't feel were fully answered. Did hear quite a bit about maybe some additional language on just routine hygiene. And so we'll make sure that we can follow up with a little bit, maybe a separate toolkit document to help with hygiene. Again, what we were really focusing on with this conversation was the infectious agents and things that we can transmit through food. But again, we'll also continue working on additional toolkit documents. I want to thank you all again for joining us. I think we covered a lot of information today. Know that you can look at our active managerial control resources on our website. Also, highly encourage everyone to connect with their local food safety contact. And this is our 4th of 5. I'm hoping that you'll be able to join us tomorrow for the active managerial control, which really sums up this entire conversation we've had about these toolkits, and the certified food protection manager, which is tomorrow, straight up 8:30. But do know that at 10 o'clock, so in less than 1 hour, we have our great session on foodborne illness outbreaks and lessons learned in Washington State. Again, the vast majority of the work that we've been doing with our toolkits are to help reduce all of these outbreaks, but unfortunately, Milei's got more to share with us. So again, I look forward to seeing you all tomorrow, also later on this morning. Reach out whenever you have questions, and we look forward to seeing you again. Thanks, everybody.